Hello, everybody out there at the Pilates Hour today. We're excited to have you with us. I see Dr. Carol Davis is blessing us with
That was one of the first names I saw.
Wow, how lucky are we? I am here with Shelly Power and with Nichole Anderson. And today we are at the Southwind Farm. I was going to say Northwind Farm. I don't know where that came from, but the Southwind Farm. And just to give you a heads up, we have had a lot of rain. So we have that tropical storm coming through North Carolina as we speak. It's just about the tail end and leaving our neighborhood, but we've had a little bit of IT concerns. So we're hoping, keep our fingers crossed, that we're going to be tuned in with you for the whole hour. We got a lot of great things to share with you. We're excited to get started. And one of the things we wanted to do was a continuation. Now, Shelly and I had started, we've done a number of webinars talking about teaching. Just to put things into perspective, Shelly is the Vice President of Polestar Education International. Nichole is in charge of education and curriculum development. And of course, you know that I am the owner of Polestar. And so we are here to talk about teaching. And in particular today, a topic very near and dear to my heart, we're going to be talking about cueing the trunk. And we get all the confusion about stability and core strength and how strong, you know, people come in and say they want their abdominals to be strong. So we're going to address some of those myths. We're going to address some proper cueing. A lot of times we tell people, you know, this is what the science shows. This is what we believe. This is sort of the philosophy of it. But I was really excited to have Nichole and Shelly with me today because we're going to demonstrate some things as well for you. So we're hoping that we can spend our time really productive. You take away some good teaching tips. We're also going to be looking at, I know we're going to talk a little bit about pathology, but what else?
Right. We're also going to talk about flow and sessions and session planning. And that's something that we'll talk a little bit about from maybe a more beginner, you're a beginner teacher and you're starting to get into programming classes and things, but also where we could go with a more senior teacher and how we can just in general improve our teaching skills in the class setting, especially.
Great. So before we get started, we got a couple Mentimeter slides. And this first one is just so we get an idea and sort of an icebreaker. List any 5 exercises that are on the same apparatus, meaning on a Pilates reformer, on the Pilates trapeze table, on the chair, don't do the mat, because we know that the setting's always the same on that, but on the piece of equipment. And what we're looking for is just, we want to show you how much you already know in a lot of ways of how do you do 5 exercises on the same piece of equipment that you wouldn't have to change or adjust the springs or the foot bar setting or the springs on the trapeze table, etc. So take a moment and just write down inside that box 5 exercises, and we'll see what if everybody has their thinking caps on today, and get started.
You know what this makes me, or who this makes me think of?
Who's that?
Do you know who I'm thinking about, or Nichole? So Darren Stoyanovich, who is one of our educators in Australia.
Yeah.
And I remember years ago, he did a full reformer class, I believe on one blue spring. It was either a blue spring or a red spring. And he did the entire class on one setting. So that was what I thought of today when I thought, let's check this out. Let's see what happens.
And while you guys are starting to put your answers in, I think one of the things we want to look at today, I'm going to kick us off with a little bit of trivia. From Polestar's standpoint, we talk about stability, and I want to be bringing this up as to what is the word stability. And we use it in fitness, we use it in rehab, we use it in Pilates and yoga. And we keep throwing it out there. And I always like to go back to the old story of my own getting my neck fused, right? So I broke my neck and had an injury and had to have a 4-level fusion. And the surgeon came in right after the surgery and he said to me, and here I'm in a collar and tubes coming out, and he says, "Brent, your neck is stable now." And my first thought was, we obviously have very different interpretations of what stability is. And so I want to kick it off today as we talk about stability and control as more of a motor learning or a motor control perspective of stability, which by definition is control of movement. So I just want you to keep that in the back of your head as we go through today's webinar, control of movement, right? And then we'll talk about how load and strength play into that as well, and how we can cue that appropriately. Let's see, Melissa, go ahead and uncover that so people can get an idea what's going on. I know it's 5 exercises. You should be able to whip these things out, but let's see what some people are saying. See if anything here jumps out at you. Semicircles, footwork, inversion, sideline, and gymnast on the reformer. So, you know what I should add you do is like put how many springs, like a red and a blue spring, but yeah, I get it. Spine, abs, bridging, front rowing, back rowing, pulling straps on the reformer. Excellent. Somebody said none, depends on the client. That's a good answer to get out of having to answer this. All right.
Those are fun.
Can you think of 5 that come to your mind?
No, not right now.
What about you, Nichole?
Lateral flexion on the chair, mermaid on the chair, reverse swan teaser. Is that 4?
Yeah, one more.
Make it
One
a
more.
circle. Make it a circle. Okay. And then maybe hamstring 1.
Nice.
Beautiful.
Love it.
What came to my mind, like I love the red and blue spring combo that I do on the reformer. So just going from something as simple as feet and straps, circles, a little bit of short spine and long spine, and then coming down and going right into knee stretch, and going from knee stretch into scooter, and from scooter into reverse abdominals. Did I get 5 or is that 4? Anyway, you get the idea. I see some great ones coming up. The idea here is just thinking of being creative in your teaching and thinking of flow, right? One of the things I love to integrate into my classes is the idea of flow with as little distraction as possible. Nichole even demonstrated, and I know she teaches more than Shelly and I combined now. But when you're looking at the idea of going from one position to another position, even something as simple as I'm doing side kick on my right side, do I make them get all the way up and over onto their left side to do side kick on their left side, or do we roll over onto their belly, do something on their belly, and then roll over onto the other side? How do we create that flow and transition? I don't know if you have some thoughts on flow.
It's become a lot more present for me since recently in the US we started teaching the mat training again. And that's a huge component of a mat class is that you have the great opportunity of no spring changes, no equipment changes. And so I think it's really put me into that mindset more, even in my private sessions. I'm maybe a little more present to the idea of how can I make this as seamless as possible, which is something that maybe comes a lot more naturally when you're teaching mat. It just happens, but then kind of bringing that into my private sessions, I think I felt more confident teaching. Maybe I feel like my clients enjoy their session more. So that's something that I've been really present to. I think the mat work is always a nice place to reference. That's the easiest place to do it. And then you would be somehow replicating that on the apparatus.
Right. Yeah. And I was thinking about, we were working in the reformer course, and this also happens in the comprehensive and mat, is going from one exercise to the next without stopping in terms of your verbal cues. And a lot of times with beginners, we hear, okay, you're going to do feet and straps, up and down. Okay, everybody come to the middle and stop. Now, the next thing that I'd like you to do is bend and straighten your legs. And then that, so you've wasted 5 seconds of time where you could just seamlessly go into, up and down. This next one is your last one. As you transition into your squats, bring to mind, and then you can go on with your other cues and how you can link together with your verbal cues each of the exercises, so the clients don't ever notice that they've even moved on to the next thing, and all of a sudden 30 minutes has gone by and they have really done this complete full workout. So
yeah, something I've told the mat students is, imagine if the whole class was one exercise. So you're just teaching one whole exercise, and they don't know that they've ever changed and started doing something else. I mean, that's a little exaggerated, but
I love that though. I like that as an idea.
So we have a question of just a quick clarification. Thank you, Dee Hargis, for asking what is scooter and gymnast. Obviously, there's a lot of nomenclature out there in the Pilates world, like there is in the yoga world and the dance world. The scooter is one leg on the ground, 1 foot on the shoulder rest, with the knee down on the mat. The hands can be on the foot bar, or the knee can be off of the mat, and you can be up in a sort of semi-squat position. But you're basically doing a knee stretch, right, that you would do on the reformer, traditional knee stretch, with one foot on the ground. So you're isolating that rotatory challenge to the trunk. So it's just a real fun exercise, and it leads into,
well, it's a variation of, yeah, it's a variation of Eve's lunge. So if you're familiar with Eve's lunge, it's very similar to that. Not quite the same, but similar.
And then I saw somebody put gymnasts in there, and you asked the same question. Gymnasts, if you do seated knee extension on the reformer, so you're sitting on the foot bar facing the carriage, your heels are on the carriage, you're pushing it out. That's seated knee extension. If you leave the knees extended, put your hands onto the bar, and then take your bottom off of the bar, push it out, drop down into a bar dip, and then come up like into a pike or a lift off of that, is the gymnast. And that's, I think that's more it's tendon stretch.
It's a variation on tendon stretch, so similar.
Let's, Melissa, give us our next thing, and we'll move right through this, because I want to get into the core control part of today's webinar.
Goody.
Can't wait. So here we go. Here's a question testing your knowledge on this. Is it ever appropriate to strengthen the abdominals? So I have seen the most amazing post of people who are 100% focused on strengthening abdominals at every expense on every character. And then I've seen people who said completely ignore the abdominals. I've even been accused of that sometimes, which is, you know, we'll talk about that more. But where do you lie? Is it ever appropriate to strengthen the abdominals? So pretty much the majority are thinking that it is appropriate. So let's go to the next slide. We see what you're thinking. And how would you respond to the following statement from a client? This is one that Nichole gets, that she got from somebody recently. And it was, I want to increase my core strength. How would you respond to that when a client says, I want to increase my core strength? I, of course, am incredibly biased, but so are you. You have your
Not really.
answer.
I do.
Well, we know how
not biased. I just have my next response to it.
Yeah. So while we're doing that, let's talk about that last question of abdominals, right? So basically, it's almost impossible to move well without abdominals. So let's be clear that from an anatomical and a functional movement perspective, we need to have our abdominals to transfer force, to absorb force, to stiffen when appropriate. And so it is completely appropriate that we can consider strengthening the abdominals. The question is how, and do we do it volitionally, or do we do it spontaneously, or do we create environments? What are some other variables that you can think of would depend on whether or not we're going to focus on increasing strength of the abdominals?
I would think what is the activity you're going to do? So if, like, I think of, I was a gymnast, and, you know, we've worked with a lot of divers and, you know, all of that. So if you have to go into a position of flexion or flexion rotation in any part of your sport, you have to be strong enough to do that and generate enough force to create a new shape. If you're standing and you need to be in a ball, that's what the abdominal muscles do. So we might need to, especially if there's speed to it, you have to do it quickly or delivering force. That would be something I would think, yeah, it's appropriate to strengthen the abdominals. If you want to be able to lift more weight, with your bicep, you need to do bicep curls and progressively lift more weight. And it's the same with the abdominals. You need to train them, and they will get stronger. So, yeah, I hope.
Let's see what people say. Survey says, where do you think that is? I love that.
That's great.
Pilates is all body all the time. Let's just get going. Right? Let's get going. Let's not ask that question. Why?
That's my question.
Yes.
Why do you want to do that? Yes, of course, that's all the core of what we do. It's at the core of what we do. Tell me more about that. I like that. A lot of times it's asking them the question, right? I think this is important for us, whether or not we have the bias of thinking of, here goes another person wanting to do core strengthening. And, you know, that's not our primary purpose. Our primary purpose is whole body movement, whole body wellness, efficiency, right? So what might be something that you would ask your client?
I'm in the why, you know, what makes you want to increase your core strength? Because then, you know, is it aesthetics? Are they saying I want a six pack? Are they saying I just had a recover from herniated disc and my doctor told me to do Pilates to increase my core strength, and that's where they learned that phrase. You know, I think that gives a lot of information, and then you can kind of take the next step from there about how you approach what they're doing.
Right.
Good.
Yeah, I've seen a couple of the answers or the questions that I ask afterwards in the responses. So that's the same thing. Is like, what makes you think that you're not strong enough now? What does that mean to you? And a lot of times it's exactly what you said, Nichole. Somebody told me I need to increase my core strength. You need to lose weight and increase your core strength. And the clients don't know what that means. And all they see is either, you know, the six pack, you know, bodybuilders, or they see, and I think we're going to talk about it, the funny pictures of Joe, where his, you know, his whole hollowed up abdominal area.
TA obsession.
And, you know, so what does that really mean? And then I go to Brent's question is what is it that you can't do that this core strength that you're talking about is going to help you do? So that's the next thing. And a lot of times I have to say, a lot of times they say, I don't really know, but that's just what I think. And it's like, okay,
that's what I've been told.
Yeah. And so let's explore what that means.
Well, that's what we're going to do. First of all, we're going to explore what that means. So let's clarify a couple of things from some scientific research. First of all, when we talk about the core, right? The core is anterior, lateral, posterior, superior, inferior. And we could think of it. I even have my tensegrity model. That we could think of the core as being sort of like this tensegrity model. I know Carol Davis is out there, so she'd be proud of me for pulling this out. Thank you for teaching me this, Carol. And when we think of any change that happens to this three-dimensional structure, whether it's an eccentric contraction of the transverse abdominis, or it's a breath that happens with the diaphragm contracting down inferiorly, the pelvic floor eccentrically contracting, that dynamically we are practicing trunk stability all the time. Just us sitting here, we're practicing trunk stability based on the demand that gravity has on us so we don't just fall over out of our chair. And what it comes down to, and this is a very important point that I want everybody to take home with them, is depending on what the activity is, right, is first. And then second is how efficient can we make that activity? So a lot of times we get the idea that we're going to do voluntary muscle contractions of our abdominals to get them really strong, but we don't integrate them into the activity and we don't go towards efficiency. Now, normal human movement, remember I said we're going to be talking about it from a motor control perspective, not a bodybuilding perspective, but a motor control perspective, which is the human naturally solves their problems based on the task, right? To achieve some activity. I want to eat, the baby's going to learn how to put food in its mouth. I want to walk, the baby's going to learn how to walk to get from point A to point B, right? There's nobody coaching the baby or the toddler, lift up your pelvic floor, pull your belly button to spine, you know, contract your TA. You're going to be taking steps now. Let's do that. You're going to lift that doll up. Make sure that you know, relax this muscle or contract that muscle. And I remember having one professor, he said, I want you to try to contract and isolate your right piriformis. Because everybody was saying they could do their volitional contraction of any muscle. And I'm like going like, sure as heck, I can't contract my right. I can't isolate. I could do a rotation of my hip that would engage all my rotators, but I don't know that it's exactly that. I would assume that it would fire with that activity. Well, I want us to think of the trunk as being the same way. So depending on the activity, and Shelly talked about this already a little bit, is that depending on the activity or what we choose to participate in, right? So if I want to be a power lifter, this goes with Stuart McGill's work, right? Stuart McGill was looking at power lifters in particular, or industrial workers. Those were the majority of his research studies. And in those cases, you needed to have the ability to have enough thickness of that abdominal wall and that trunk to be able to have almost like he called it the guy wire system, to be able to stabilize and have enough intra-abdominal pressure, another very important phrase, intra-abdominal pressure, to be able to withstand the load of 400, 500, 600 pounds, whatever they're lifting. However, if I take another profession, let's say a golfer, does a golfer need to do a guy wire kind of stabilization that McGill was talking about? Or is there something that is more natural and more efficient? Even Hodges in his work where he talked about the TA acting 50 milliseconds prior to the primary muscle contracting would be an example of anticipatory preparation for a load. And that's where I do want to do an experiment now. And I think we can do an experiment.
Yeah.
Yeah. So I'm going to stand up. We're all going to stand up and we're going to do it. We want you to stand up and do this experiment with us. Okay, everybody ready to stand up? So we're going to go with some of that, and I'm going to get a little camera adjustment here from Melissa. But let's try some of the old approaches to core strengthening. A lot of the verbiage we hear inside the Pilates world, the physical therapy world, now the personal trainer world. But let's hollow our abdominals. Let's pull the navel, the spine, get that great picture like we had of Joe in the past. Lift that pelvic floor up, so that pubococcygeus lift, and really feel stable, right? And now rotate around that central axis naturally and efficiently. So it's just fluid, right? Yeah, that's not going to happen. So relax. Now let's change an image. Let's go with a mechanical image. Let's think of each of the discs in our spine as being like a little balloon or an inner tube. And we're going to let all the air out of all 23 discs and just let the whole spine slouch down, right? And now we pump it back up, all 23 discs, and it puts our spine in a nice axial elongated position. And here we are without any concentration on abdominal muscles. Keep the focus on the disc in between the spine, right? So nice and pumped up. Now we rotate around that central axis. And you might be noticing already how much more efficient that is. But now imagine that you have a 20-pound kettlebell in each hand and see what happens to range of motion, what happens to stiffness in the trunk. And then let's let go of those kettlebells. See what happens in the rotation. And now grab a 45-pound plate in each arm and do the rotation. And see what happens, just even with our imagination, how the body organizes itself. And now get rid of the plates and go back to that rotation. Now imagine you got a bag of groceries in each hand, right? And so because of, and let's come back to the table here, because of our history, because of our experience, our anticipation knew how to organize. What were some things that you noticed while you were doing that you felt?
Well, from the first one to the second one. So the faulty abdominal contracting, muscle contracting, to the just rotate around with the discs pumped. I always feel, I feel less tension, which kind of goes without saying. I feel less tension. I get more range of motion. I feel like my arms just kind of flow with me. There's this really, it's like a winding and unwinding kind of feeling. So that's what I get.
And what about you? What about when we played with the images of the weight changes?
It felt very natural. I mean, also I'm familiar with those things. So I think if I hadn't ever held a 45-pound plate, maybe it would be different. But when I go to the gym, I do. I'll carry that around. And so it was very familiar, and in my body I could feel the heaviness and the stiffness kind of appropriately.
Yeah. Right.
You know.
Can we do one more thing? I know you were going to say it, but can we do one more example of something?
Yeah.
Okay, go ahead and finish your.
I was just going to say, you know, we have a patient that we did a case study with everybody with not too long ago, Jeannie. And one of the things that we noticed with Jeannie that became very obvious, she is obese. She is probably about 150 pounds overweight and complaining of hip pain. And when we really narrowed it down into her symptoms, remember we saw that her primary complaint of pain was walking in the hips. And so we noticed that if we could relieve about 35, 40 pounds of weight from her, her hips no longer hurt. But I did a little experiment. We were over at a gym and I picked up a barbell that had 245 plates. It was about 135 pounds. And I just picked it up and walked around the gym for a while. And I realized that my gait pattern looked just like Jeannie's pattern. And so, we don't realize it sometimes, thinking that why can't she just walk more natural? Why couldn't she just be a little more reciprocal, a little more trunk rotation? But when I realized holding that much weight and trying to stay up, the amount of rotation that was available to me because of the natural stiffening my body did to protect me from that weight was greatly reduced. And I think that, when we are looking at our clients and we see different clients, different weights, different movement experience backgrounds, the novice is always going to over recruit. They're always, it's like Nichole said, like she knew what it was like to carry a 45 pound weight, but somebody who didn't would probably recruit more muscle than they thought, just trying to be protective in their nature. So, yeah.
So I thought we could all do the 100 because, what's a day without but I just was thinking again and working with some new students and back to more teaching, both classes and education, is even though we know these things, and I love it when Brent puts up the Mentimeter, asks a question about these topics that we continually talk about. We're continually talking about load and gravity. Are we, using gravity to our benefit? Is it causing resistance to us? The breath, anticipation, all these things that somehow they sneak into all the different webinars, because it really is the fundamentals that we're built on for movement, that we hear it. The Mentimeter things come up, Brent asks the question, all the things come in, they are completely in alignment with kind of our philosophy on this. And then I hear people teach, and they teach the way that they were taught before. And so somewhere there's a disconnect between this information that if we ask you the question and say, what is this? And you answer based on this information and our foundation and fundamentals, yet when you teach class, not everybody, but it happens, I still hear the old cueing of muscles, including the abdominals. And it's not that it's horrible, but it's not very effective and it's not very efficient. And we're not really teaching people how to move better. So I thought the 100 is one of those key exercises where people, it's a core exercise. So we must engage our core. So let's just try it on. And it is, sometimes it's hard to put on the hat of a novice when you've been doing this exercise for, most of your lives, but just play along and try to just follow the cues. So you can do it where you're seated, you can lie down or stand up, whatever you like. So imagine yourself in the position of the 100, maybe legs are at tabletop. They can extend out if you're lying down, you're in that position. Really engage your abdominals, because this is a core exercise. Keep drawing your navel to your spine, keep pulling it in, keep the abdominal area flat, and now start to breathe. And exhale. And inhale. And you can start to feel how if you really okay, everybody can stop doing that. If you really massively engage your abdominals, which is what your clients will do when you tell them to pull their navel to their spine, they will do that and they will over recruit. So you'll notice how you can't, there's two main things that'll happen. One is you'll keep the abdominal muscles and trunk muscles so tight that there's no space for the diaphragm to move. So your breathing starts to get into this feeling, or the opposite happens. The abdominal muscles go, no way, man, I'm not gonna do this. But instead of having control, there's just a blowout of the abdominals. And that's where we see the rectus pufus and all the jargon that people talk about. And eventually what we don't want to see is a change in the shape of the body. So people get really concerned about the abdominal muscles in the 100. And yes, they're working, and yes, that's true, but where we aren't putting our focus is on the body position. So you could choose to do it with a more neutral spine alignment. You could do it toward flexion. You could do it toward extension if you wanted to, if you had the control and the need to do that. And then you've got to play with the breathing. How everybody breathe in really fast. Take a huge breath in really fast. That's how people cue the 100. Inhale, exhale. And it causes this whole change of the spine movement following the breath, right? We have both of those pieces. So when we ask you, we hear the correct responses, but sometimes when we're doing, you're actually teaching, you're falling back in. And I do it myself. I fall back into patterns from before. Yet if I watch someone teaching the exercise and doing it at the same time, the teacher's not following their own directions. So I find that really interesting as well. So I'm doing it the way I know how to do it that's efficient, yet I'm telling you guys to do it in some way that's not efficient.
Yeah.
And there's
That's
just
a
a
traditional
really
ballet.
big,
That's a traditional ballet thing. Like
it
the
is.
ballet
Yeah.
dancer learns
Yeah.
how to cheat and dance and perform beautifully, and then when they retire and become a teacher, they go back
back
and
to their own
teach
ways.
the
Yeah.
original way.
Yeah.
You know, it's there's a question on the table from Sarah Edwards, and it's a great question. I don't know that I can even answer it, but I'm going to attempt to. It says, what do we think Joe's underlying principle was for his core contraction approach? And I don't know what he was thinking. I know that he referred to it as the powerhouse. Again, I think that, you know, there were so many amazing things that came from Joseph and Clara Pilates as far as whole body health, whole body movement, using assistance to be able to work through ranges of motion to become more efficient. But there's no system out there that's perfect. And I think that sometimes, you know, we look to try to find a fault or two. I do think this is one area that we have some great research out there now. As a matter of fact, there's some new research out by Dr. Letterman. He's an osteopath out of the UK. And the things that he's looking at, he's done some systematic reviews of core control exercises and things that are out there in the fitness and the Pilates world. And basically came to the conclusion that not only is core control no better than any other exercise for low back pain, but that it actually could be detrimental with the way that we're teaching it. And so his key focus was any kind of voluntary over-recruitment of the abdominal wall in an exercise would actually interfere with normal neuromuscular behavior of the task at hand. And so I'm glad you brought the 100 up, because the 100, I really do enjoy the 100. It's something I still practice, the 100. And one of the things that I appreciate the most about it is that it has duration built into it, right? So theoretically, it's 100 beats, which means we have to breathe. It's a breathing focused exercise. If we find that the load is too great that we can't breathe, then we're doing the exercise inappropriately. And we teach that how do we modify that load so that we can really get 100 beats over a period of time, sustaining that constant load against gravity, where the knees are bent or one leg's out straight, or you're at 45 degrees, you're down at 20 degrees. The other thing that I really appreciate about this is I believe this teaches us, and this goes back to some of Stuart McGill's work of people that are lifting boxes. Let's say that we're working in an industrial setting, or we're moving our household, we're picking up these boxes. We got to move them from the truck into the house. The box weighs maybe 30, 40 pounds. And we have to be able to breathe while we're carrying that box. So that breath that happens there, it's interesting to watch people who don't have the coordination of having core control or stability dynamically over time through breath, right? They either breathe or they Valsalva, right? And so they'll, and they hold that breath as they carry the box all the way in, and then they set it down somewhere, and then, and they do Valsalva again. And so one of the things that we try to teach people is that obviously your trunk musculature is not strong enough or have enough endurance to be able to maintain the ability to have the control and the function of breath over time. And so if I was to go into, let's say, a moving company, I would be teaching the 100 left and right and other exercises of having them lift kettlebells and be able to carry them for a while, and breathing exercises like the 100 while they're carrying it, saying like, look, you have to be able to eccentrically contract the TA and the pelvic floor. And a matter of fact, I saw a post today by Dr. Moses, I think he's in Toronto, a chiropractor up there that was teaching some beautiful concepts. And he was getting really excited about the idea of if the diaphragm contracts and descends, the viscera has to displace, and it's going to be an eccentric contraction of the TA or of the obliques or of the pelvic floor. That's exactly right. And, you know, when we do the ultrasound studies that we've done, looking at the pelvic floor, we sort of see the same thing of those that over-recruited their abdominal muscles, thinking they had to hold this powerhouse, actually wanted to recruit the pelvic floor to lift it up volitionally, and they were pushing it down.
Mm-hmm.
And the ones who really had a problem actually had complete diaphragm insufficiency. They were so tight in their abdomen that the diaphragm couldn't even descend to be able to have a full expansion of the rib cage. They were over recruited. So if you looked at that angle at the bottom of the sternum, they were probably under 75 degrees, which would also be considered unhealthy. That's not healthy. You can't get diaphragm breath. You can't move.
Yeah. Oh, go ahead, Nichole. Go ahead.
Oh, I was just gonna play off of this idea of the powerhouse. I don't think it's obsolete in any way. I think maybe the approach is obsolete, because if we look at someone who's a tennis player who just started playing tennis after working on a desk for a long time, they might not have the strategy to have the synchrony from their foot through their trunk. To get the power for their swing should really come from their trunk, but you don't find that by telling them to cue their abdominals, right? Maybe their pattern is that they just extended their low back and go. So it would be working on the alignment with elongation throughout their swing, and then unwinding and winding up and unwinding. So with alignment and breath, you're tapping into what I would consider a powerhouse. It is your powerhouse. If you're playing a sport, any type of rotational sport, your power is coming from your trunk. If you're playing golf, but you find the power because you're aligning yourself appropriately and you're distributing the load across, and then you're getting that full force.
Right. Up through the arm, down through the leg, or vice
And
versa.
a lot of that is elastic load.
It is. Well, I love that you said that,
But
elasticity.
It's the middle connector. It connects the pieces. So if you're not.
It's funny you say that, because Yale, our senior educator in France, brought up that same comment. And I think this comment's very appropriate. She says, could we say we have lots of core in our body in every region, like neck, shoulder, etc., and it's not appropriate to address only abdominal core, but coordinate our cores. And if you think of yoga, really the original, right? Bandhas. Yeah. So sometimes everybody sort of knows the Mula Bandha, but do you know the Mansi Bandha and the Jenu Bandha and all the other bandhas of the joints of the body? And really, it was what is his name? Simon Borg-Olivier. Out of Australia, wrote a book on the anatomy and physiology of yoga, physical therapist, second, third generation yogi. And one of the things that he talked about by definition, so that we could understand as physical therapists, was that the bandha was a co-contraction of a joint complex. So again, if we go back to our motor control idea of, so what Nichole was just mentioning, is this coordination of elasticity and movement and alignment that goes through the center of our body. If we don't have proper organization and the efficiency, right? Because remember, most power comes from speed, right? It's momentum. So when you're thinking of golf or tennis or volleyball, it is the end speed of that lever going through space that depends completely on the elasticity of that trunk or core and the connectivity into the lower extremity. And that becomes super important. And so as Pilates teachers, what do we really should be focusing on? Alignment, whole body.
Mobility in places.
Whole body, right? It's like, that's the thing that turned me on the most about Pilates, was that it was a whole body approach. And this is goes back to some things we used to joke about with Dr. Davis. We'd all be discussing like what's going on with his shoulder, and she'd walk by, check their left ankle, and it's like their left ankle for a right shoulder. Like, what are you talking about, Dr. Davis?
It's all connected.
And sure enough, it was the left ankle. So this idea of elasticity, and the other thing that I'll mention from Carol's standpoint, she's been on this program a couple times, is obviously fascia. And so when we think of connectivity and fascial organization, and not just fascia of the muscle, but fascia of the bones, fascia of the connective tissue of the joints, the capsules, the organs in the body, right? All connected. And I see Carol just posted a comment here. She says, elasticity is so dependent on fascial openness. So don't forget the identification of fascial restrictions and release them. And this was, I think it was just a couple of weeks ago, we had, it was you, me, and Elizabeth talking about our treatment intensive of that mixture of having the myofascial release. When we find structural restrictions, that we can free up the restrictions. I would assume this would probably be true with my new friend, Dr. Moses, that from a chiropractic standpoint, same ideas. We use our manual therapy to release restrictions, but then we integrate that into whole body movement and sort of that thinking more of being power coming from the elasticity.
Yeah.
Now, how strong does the tissue have to be to provide that elasticity?
Right.
What does it depend on?
What you're going to do.
What you're going to do,
Yeah.
right? So when Nichole stood up to do the tennis swing, you know, if you're playing tennis, you have to have strong enough abdominals to be able to, you know, transfer that force through the body from the ground up to the tennis racket to the tennis ball.
Just really quick, because I know we're getting kind of toward the end of our hour, but just thinking back again about the Joe question and the pictures of him, it's what I also tell our students about the pictures in the manuals. It's a snapshot. It's a snapshot in time. It's one little piece of something. And I think we've, you know, maybe put more focus on this scooped and hollow abdomen than Joe maybe did, because remember, he was involved in both bodybuilding. So his uncle, there's some, you know, family members that all did bodybuilding.
His brother and his dad.
Yeah, bodybuilding, posed for anatomy charts, and he was involved in boxing. So if you don't have, you know, rapid firing abdominal muscles, you're going to get smacked in the face, right? You've got to be able to move. You've got to be able to move to get out of the way. You've got to be able to move to throw a punch, which comes from the powerhouse.
Do that punch again. That
Was okay.
Yeah, that's good.
I'm all right. I learned from Michelle. But seriously, and then we capitalize on that and take it so far out of context, because you look at a lot of pictures of Joe and he doesn't look like that.
Yeah.
So I think we also, we need to maybe step back a bit and think, okay, yes, this was important, but this is, you know, this is a snapshot. Maybe it wasn't even the picture he wanted, right? Maybe it was the next picture that he actually, you know, wanted. And
I know how that feels.
You know, just anyway,
People
just
have
something
pictures
to,
of me all the time. I finally had
to think about. So there's a couple other questions.
And I was going to also mention, you know, in yoga, that is a pose and that is a breathing exercise, and, you know, to hollow the abdominals and to expand the abdominals, and it's dynamic.
Yeah.
There's all this movement. So the thought of holding something really is not in alignment with our belief of movement. There's a great question on the Q&A from Maya Taylor. And I think this is, you know, if we can translate all of the information we're talking about, the abdominals, to the entire body.
Mm-hmm.
So her question was, is this applicable to when somebody tells somebody to tighten or squeeze their glutes? And yes, it is. One of our, you know, I've talked about the study and many times, I know we have some new guests on here today, but when we were doing the ultrasound, we wanted to compare a voluntary contraction of the pelvic floor, a spontaneous one of sit to stand, and then a mechanical one related to breath. And it was interesting that even with experienced movers and Pilates teachers, the voluntary contraction resulted in like 45% of them doing it correctly out of 250 teachers. Where when we looked at spontaneous, it was about 90%, and with breath, it was 95%. So when we're teaching, this is what we want to shift the way of thinking about. We talk about this a lot, and we'll continue to do so, is can we as Pilates teachers and physical therapists and chiropractors and yoga teachers create the proper organization or orientation to gravity with the load and the activity that the client wants to participate in, to be able to gradually increase strength and mobility and, you know, response time, quickness, elasticity. And if our exercises are focused on that, I mean, this is sort of the nice default, is in Pilates, if you do a whole body workout in Pilates, you're going to get every direction of the body, different speeds, different orientations, mobility, stability, control. They're all built into our whole body workout. When we dissect it apart and we're telling people things, and this is where we sort of cringe, is when somebody says, you know, squeeze your glutes, or, you know, squeeze your thigh muscles, or squeeze your quads. It's like, when was the last time that while you were running or walking, you had the idea to squeeze your thighs or squeeze your glutes? And probably never. And if you did, like me, like I would try it just to see what it's like. It's completely inconvenient.
You do it for about 2 seconds and then you stop.
0 sense.
I love this next question. I don't know if
Go ahead,
if you want to. Well, no, go ahead and read it. I can't actually. It's hard for me to see, but I think it's a great.
All right. So this is from Natalie Faustino Gabellone. How would you recommend we go about adjusting our cueing and approach when the education out there is still geared to this old methodology? Fantastic question. Social media, Pilates Anytime, and other platforms out there, the teachers are all still saying the same thing. Old habits are hard to break, right? And there's so many great things about the work we do, and there are so many beautiful images and cueing out there. What we're saying is that the science doesn't support the efficiency or efficacy of doing voluntary muscle contractions as part of movement education. Doesn't mean I still use it as a physical therapist when I need to create an isolated contraction. Somebody coming out of surgery, I need to wake something up. I still use things like electrical stimulation to wake up a muscle that's been sleepy for a long time. But in general, as a Pilates teacher, if we could steer away from, that's why I wanted to have Nichole and Shelly with us today, is to talk about what are some of the new cueing that we could do to replace some of the antiquated cueing that actually is not so effective.
Do you have one that you want to say? Because I can take it, but I didn't want to take if you had something. Yeah. So one of the things, and this is again, this is an assignment. If you are a Polestar student in any of our courses, you have to do this assignment of audio taping or videotaping yourself. And then you got to go back and listen to it. You got to go back and watch it and listen for those types of cues. So if you already have an awareness of it, as we say, your RAS, right? Your awareness is set to pick up on some of those things. When I do classes online sometimes, and I listen to teachers, or I do, something on YouTube or a yoga class just to mix things up. The first time it went, squeeze your abdominals. And I just think, really? Like this? Is that how that's, what does squeeze your abdominals mean? And so I'm hypersensitive to it. You will be too. And you'll start to notice in your own teaching, oh, I just said that. It's not the end of the world. No one's going to die because they tighten their glutes or, squeeze their inner thighs or something.
Practice.
It's okay. But just start being more aware of those types of cues and how can you replace it with something else? And the something else for me is, something like alignment. What is the alignment that you want out of this particular movement? Every movement has an alignment or has some different alignments that it could be in. You could do something that's all in flexion, like the stomach massage, for instance. Stomach massage, you're in flexion, then you're sitting up in a more neutral or vertical body. There's versions that go into extension. There's versions that go into rotation. So in each of those positions, what is the alignment you want? And put your cues toward that. Or what is the quality of movement that you want? Is it something that's very smooth? Can your voice go from this type of thing that you're cueing something staccato to something a little softer, a little more gentle, so that not only the words that you're choosing, but your voice intonation and speed is starting to cue that. And just look for those opportunities. Where is the place that they need more mobility? Or where do they need a little bit more control? Where are those places in the movement? And what would be, I often tell my students, if somebody was going to make a mistake, we all make mistakes all the time. What's the most common mistake of this particular exercise? So maybe we could say the 100 common mistakes are holding your breath, allowing the body to arch, pushing the abdominals forward. So if you know those things, start to layer in your cues before they've even made those mistakes, so that already they're in a better position. So those would be some things that I would encourage all of us. You think you guys have to do this on your mobile phones and you tape it and you watch it. Try putting things on things like YouTube and Pilates Anytime or the Polestar platform, and then you listen to yourself like, oh my gosh, I said that. And it's not about being perfect and never saying those things. It's about, what do you do most of the time? What's the 80-20 rule of this? What do you do most of the time? And how effective are you at getting the result that you want? And one last thing is, do you even know what the result is? Or are you just counting and leading the choreography? If you don't know what the desired result is of this movement for this client, you need to go back and review that and put your focus there, because that is hands down, that's why we're doing this. Anybody can just listen to directions. So really get involved in it.
I'm seeing some questions I can speak to maybe a little bit. I think this one's really interesting about working with clients who've been stuck in an incorrect movement pattern for a long time, and specifically using an example of footwork and not using the glutes or the posterior chain. One thing I would say is that wouldn't be my main thing I'm trying to work there, that maybe if they're struggling to turn on their posterior chain, maybe I would do an exercise that's maybe forces you to use your posterior chain. So something that if you don't use your posterior chain, you will fall. Like maybe standing like scooter, for example, would be a great option. Or standing single leg pump on the chair with a really light spring, having them feel that lift and length. Their posterior chain will turn on to support them balancing and things like that. And if you get the pelvis in the right place, balanced over the femur, their posterior chain will turn on. Maybe they're in a bad pattern where they're always in a posterior tilt, and so they don't really need to use their glutes. So getting them to lift and find that length. So I think if they're not getting it at that exercise, maybe it's the wrong exercise to help them find it. And you might have to like play around a little bit. And it's always okay to say, you know what, that's not really working. Let's try something else and try that other thing. And see if you get the result you're looking for.
Yeah,
that's great.
I like that. The question from Tara that you just answered. If we understand the exercises well enough, we know what actually is being loaded, and we can modify that load in the Pilates environment. So we can very quickly, somebody who has completely forgotten their posterior chain, we can create assisted environments in an exercise that we know loads the posterior chain. I think this is where a lot of our deficiencies are in education programs, is we're teaching choreography. We're not teaching what the exercise actually influences or how it impacts us. The other interesting thing here is every exercise impacts us a little bit differently, each person differently. So a lot of times you have to ask, and this is, one of Shelly's biggies, is what are you feeling when you do that, bent knee leg pull? If you're in a leg pull position, bent knee, can you get your hips up, horizontal, or the hip flexors so tight that you can't even get into that position, which would tell me right there, you're not going to get into a glute extension. You can't even get there. So that's where you go see Dr. Davis, get all myofascial release, then come back and do some more work to get you even in a place where the alignment would allow you to have the load when you're in the right organization with gravity, right? And Yale also brings up another point here in talking about cueing, right? This is really what we're talking about. We're so stuck on thinking that we're going to cue the movement by the muscle instead of cueing the movement by the bone structure. Or as also brought up, Susan Adams talks about the idea of spatial. We love Eric Franklin's work, right? Eric Franklin has some amazing imagery, both internal and external imagery, but it never focuses on the muscle. It focuses on, where are you sending those bones in relationship to space? If we find other kinds of images like fans and accordions and, springs and things like that, that we can use to make sense to our clients to be able to integrate a new vision and image of how their body should be working. Theoretically, the majority of our work should be subconscious and sub-threshold if it is to be incorporated into our body. If we have to think about contracting a muscle to move, we're going to have a problem. But can you think of a posture? Can you think of an external image? Or like we did with the balloons inside the disc, can you think of that image very quickly versus thinking of every muscle that would have to work to be able to do that position? So these are really good things that you're asking and the suggestions you're making. I do have another comment here, and this will be our last one for today because we're out of time. This is from Giorgio. He says, could the main road be to help people to experience their ability to be strong and then be more fluid doing the same exercise so they can understand how they are responsible of their postures and expression in life? And I love that comment. It's a great one for us to finish with. Is remember we talked about going from novice towards more proficient movers. And the novice mover is always going to over recruit. That's a very normal thing. Imagine when you learn to ride a bike for the first time, or the first time you went to lift weights. Our body also has protective mechanisms built in it. So if you put too much load too quick, your Golgi tendon organs are going to shut those muscles off, or your muscle spindle fibers might cause a reciprocal inhibition. And you might find that you don't have the strength to do it. It's not because your muscles don't have the capacity to do it. It's that they don't know how to do it. So Giorgio's point is well taken. We teach them and give them positive movement experiences in our modified environment that they go like, oh, wow, I understand that movement now. Great. Now let's take assistance away. Let's increase the load. Now, great. Let's take that to the next level. and look at how it ties into that particular functional activity that you're trying to return to, and to have successful movement patterns that maybe don't cause potential risk of injuries or increased potential performance.
Yeah. I mean, people can't do things. I've said this, time and again. People can't do things. It's not because they can't actually do them. It's because they don't yet know how to do them. So we try to put, oh, well, I'm going to be the teacher. I'm the best teacher, and I'm going to teach you how to do that. Really, they already know how to do it. It's kind of like what Carol says, if people knew how to heal themselves, they would, and they wouldn't be sitting in your clinic, right? We have this amazing capacity to do things, but sometimes we just don't know how. So as a teacher, the better your cueing is, the better your clients look like they're doing. But really, it's not us as teachers, it's them. They're the ones doing it. We're just facilitating that and giving them the information that they need to do. So the clearer, more efficient, more system-based information we can give them, and then, give them something they can focus on. I tell my students, what if the exercises that you're teaching your clients right now, what if they actually practice them at home? I don't know. I hope they do. I think now they do more practicing at home, but would they have the information to know what to do when they're doing the exercise, or do they just hear your counting in their head, or right, left, right, left? Give them something, give them a piece of information that it's really tangible. I need to maintain this position, or I need to move here. And that's going to help. That's really going to help them understand it so that they can succeed.
Yeah. Nichole, you have any last things you want to share before we?
Yeah, I know we're running over a little bit, but I think something that's really important in this whole idea of cueing and being successful with your cues is to be very present when you're teaching.
Mm.
So the minute you have some kind of distraction, you're not going to catch that you used a cue you weren't wanting to use, or falling back into an old pattern. You're not going to know if your cues were working. You're not going to catch on to the subtleties of your client or clients if you're teaching group class, to know what cues they may need or what changes you might need to make as a teacher. So I think as is almost a broader thing when you're instructing, to find strategies to make sure that you're able to be present. I think Laura wrote a blog recently, and it's on our thing, a little bit about dealing with the nerves and coming up with some ritual and stuff before you teach. And I think that's a really important thing to mention when we're talking about teaching and cueing, because if you're not present, your cues aren't going to be present either.
Mm-hmm. Yeah, I think it's super important.
Well, thank you both for being with me today on the Pilates Hour.
Yes.
And again, we just love being enlightened and getting new information and sharing that information with you. We appreciate you taking the time to be with us on a Thursday afternoon. Those of you that are watching this afterwards, we thank you for joining us. And if you have questions, please send them to us. We'll try to address them in the next webinar. And we'll get information out to you soon for the next webinar coming up on Thursdays at 3 p.m. Please share them with your friends and with colleagues, and we'll try to keep them interesting and applicable to your roles in the Pilates community and health community. Thank you. Be safe and be kind, and we'll see you in the next Polestar Pilates Hour.